it is true, though, what Dr. Faisal said, that in the past, when the federal government had left the issue of primary health care to local governments and to states, things have not really quite worked out. And it is for this reason that they felt the need for an intervention, and the agency, for example, that he heads is supposed to do certain things. What are your views regarding this?
Thank you very much. That is where the problem is. We will not get it right until the right thing is done. Let's go back to basics. Nigerian Constitution recognizes, the concurrency of health, with federal government, state government, and government. Primary health care for local government, secondary health care for state government, and tertiary health care for federal government is not a law. It's a policy. And as a policy, it's difficult to enforce. That's number one. Number two is that we are using moral persuasion and cajoling, including blackmailing, in enforcing it.
Please explain what you mean by that.
What I mean is that something that is not a law, and you are expecting it to be implemented, you are using the moral persuasion. Please let us do it because it is for global good. It is for your own community good. Having said that, you will not expect the local government to be able to discharge adequately on the primary health care provision as long as there is the currency of the resource responsibility mismatch. 80% of healthcare problems are supposedly at the local government level, at primary healthcare level, where just between 15 and 20% are at the top of the roof. But 80%, more than 60% of the resources are at that roof, and you are giving less than 20% of the resources to somebody who is supposed to sort.
All right, I'm going to have to take a break, and when we return, we'll carry on this very engaging conversation. Don't go away. We were discussing what you saw primarily as some of the issues why local government would necessarily fail to provide adequate primary health care for its people. And I'm trying to understand, are you saying that the current arrangements, as far as you're concerned, don't work, and so an agency such as the one headed by Dr. Shuaib does not need to exist, or what? I want clarity on exactly what you're saying.
Far from it. It must exist for the purpose of coordination and national mechanism for primary health care to work. It's a central agency, if not much more central than some of the diversification we are having in the primary health care environment. What I'm saying in essence is that if the the local government areas are empowered, the empowerment can come, for instance, by the legislation to ensure that the local government have their autonomies. That means they have their direct funds from the federal government. Then you can now start putting the blames on their lap that, look, you are not doing what you're supposed to do. Number two is that, as even the executive director of Primary Healthcare Development Agency himself knows, that a lot of resource empowerment needs to be divested or cascaded to the local level, to the C level, that is at the local government level, to enable them to function. An agency like National Primary Healthcare Development Agency is providing not just so many others, but in technical, and if it's over-labored.
Okay, let me stop you there.